Human Immunity by Meghan. Section 1. Infectious disease. There are 4 causes of infectious disease: bacteria, viruses, parasites and fungi. Diseases can spread through direct contact, indirect contact, insect bites and food contamination. Pathogen is a disease-causing organism. Bacteria are small single-celled organisms, for example strep throat. Viruses are smaller than bacteria and can only replicate within a host organism, for example the cold or the flu. Fungi are single-celled organisms, for example ringworm or athlete sport. Protozoa are single-celled organisms with a nucleus in the centre, for example malaria. An antigen is a toxic or foreign substance which induces an immune response in the body. They can be in the form of a protein, a carbohydrate, nucleic acid and fat. Lines of defence. There are 3 lines of defence. The first line of defence involves physical and chemical barriers like the skin, the hair, the nails, which is known as the integumentary system. The epidermis layer of the skin blocks microbes, chemical irritants and toxins. Other barriers include mucous membranes, which is tissue that lines the surface of our eyes, our ears, our nose, our sinuses, our mouth, our throat, our gastrointestinal tract, our respiratory tract, our urogenital tract and our vaginal tract. They are coated with secretions that help fight any germs. Tears from our eyes contain the enzyme lysozyme, which protects bacteria from entering the eye. The digestive tract contains barriers like stomach acid, pancreatic enzymes, bile, intestinal secretions. Also, intestinal contractions and the shedding of cells help remove microorganisms, and frequent urination flushes out pathogens and toxins, and cilia helps push pathogens away from the lungs. The second line of defence. The second line of defence involves non-specific responses. An inflammatory response occurs where the blood vessels dilate to allow blood circulation to increase. Cell walls develop gaps to enable blood to pass. The increased blood flow results in an increased immune response. A large supply of proteins and an increase in body heat establishes an antibiotic effect. The symptoms of this include redness, swelling and pain, and the inflammation will continue until the infection is healed. Phagocytosis is the process of engulfing and destroying foreign substances and damaged invasive cells, which is part of the second line of defence. During inflammation, monocytes, which are white blood cells, they become macrophages with enzymes that target cells that need removing. The engulfed cell becomes what's known as a phagosome, which forms a vesicle around it and fuses with the enzyme lysozyme. Neutrophils are white blood cells that defend against pus-forming bacteria. They engulf the invading pathogens and release cytokines, which are small proteins that help the immune response. An example of a cytokine is interleukin, which targets white blood cells. Complement proteins are a group of over 30 small proteins that, when activated, can form a cascade of reactions and attract phagocytes to remove particles and attract proteins that attack invading cell membranes. Section 2. The third line of defence. The third line of defence is a specific defence producing antibodies, lymphocytes and memory cells. More specifically, the role of T cells and B cells play an important part in the immune response. Acquired immunity is a learnt response from the body's immune system and how it remembers to attack pathogens. It's also called specific immunity, as the immune system adapts to attack a specific antigen. Artificially acquired immunity can occur either actively due to intentionally being exposed to the pathogen via a vaccine or passively by exposing the body to pre-formed antibodies. There are 5 types of leukocytes involved in defending the body. Neutrophils are the most common white blood cell and are the first to approach an infection. Eosinophils are able to release toxins to kill pathogens and can indicate a parasitic infection, allergic reaction or even cancer. Basophils are the rarest white blood cell that secrete anticoagulants to act against hypersensitivity. They fight fungal, bacterial and virus infections and can release enzymes to fight germs. Lymphocytes are round with a large nucleus that play a huge part in the immune system by producing antibodies. And monocytes are the largest white blood cell and are made in the bone marrow. Lymphocytes. Cells of the acquired immune system include B cells and T cells. There are 3 types of T cells: cytotoxic T cells, suppressor T cells, and helper T cells. The role of the T cell is to kill the infected host, to activate other immune cells, to stimulate cytotoxic T cells, and to create an immune response. T cells have T cell receptors on the surface which recognise antigens and then trigger an immune response. Cytotoxic T cells kill infected cells by releasing enzymes and a protein that destroys cells, but they do require assistance and signals from other cells to be activated. Suppressor T cells suppress cytotoxic and helper T cells to regulate other cells, which protects us from an autoimmune attack. The role of B cell is to produce antibodies and to present antigens to T cells. Plasma cells are B cells that secrete antibodies to provide immunity, and memory B cells save the memory of specific antigens so that they can be used again if needed. Immunoglobulin. There are many functions of antibodies, such as targeting an infection, recruiting immune cells, neutralising toxins, removing antigens, and many others. There are several types of immunoglobulin. Immunoglobulin G is the most common antibody and protects against viral and bacterial infections and attacks against anything foreign. Immunoglobulin A is involved in the cellular defence of mucosal surfaces of the body. Immunoglobulin M is the first antibody made when fighting an infection, and immunoglobulin E is made in small amounts in the blood and is only present in low levels in a healthy individual. And immunoglobulin D, the function is unknown. Self-recognition and tolerance. Self-recognition is a process by which the immune system distinguishes between the body's own chemicals, cells and tissues and those of foreign organisms and agents. Antigens not recognised before are known as non-self, and the immune system response will be activated. There are 2 major histocompatibility complexes involved in distinguishing between the 2. There's MHC1 and MHC2. MHC1 is on the surface of all nucleated cells. It acts as an early warning to the cell so that they can degrade foreign proteins and present them on the surface to be recognised. MHC2 is only present on some cells. It has a similar role than MHC1 by presenting antigen fragments which are picked up by T cells, which target any cell expressing the antigen. Hypersensitivity is an abnormal overreaction of the immune system to an antigen it has previously been exposed to. Self-tolerance is the process by which the immune system recognises and does not respond against self-produced antigens. If the immune system loses this ability, the body can start to attack its own cells, which may cause an autoimmune disease. Rejection of transplanted organs. Organ donation and transplantation is removing an organ from one person and surgically placing it in another whose organs have been damaged or have failed. Organs that can be donated include the liver, the kidney, the pancreas and the heart. However, the body can reject the transplantation and recognise it as foreign due to the different antigens present on the surface of the organ. Tissue typing reduces the risk of rejection by trying to match with similar tissues and organs. Monoclonal antibodies knock out T cells, which are the main cause of rejection, so by taking the medicine before and after surgery, it can help prevent rejection. There are 3 types of rejection. Hyperactive rejection occurs a few minutes after the transplant. Acute rejection occurs from the first week up to 3 months after the transplant, and chronic rejection takes place after several years. Autoimmunity. Autoimmunity is the immune response against its own cells, tissues and organs. Autoimmunity disease can affect several areas of the body with no known cause. There are more than 80 autoimmune diseases, and there are 4 categories of hypersensitivity disease, which is immediate type hypersensitivity, antibody-mediated hypersensitivity, immune complex mediated hypersensitivity, and cell-mediated hypersensitivity. The potential triggers for an autoimmune disease include bacteria or virus, drugs, chemical irritants, and environmental irritants. Common signs of an autoimmune disease include inflammation, redness, heat, pain, and swelling. There is no cure for the diseases, however, there are ways to decrease symptoms and prevent flare-ups. Graves' disease is an autoimmune disease where the immune system produces an antibody to one part of the cells in the thyroid gland, which results in the overproduction of the thyroid hormones. The symptoms in this include nervousness, anxiety, irritability, hyperactivity, mood swings, difficulty sleeping and feeling tired. Some physical signs of Graves' disease can be swelling in your neck, irregular or fast heart rate, twitching or trembling, warm skin, excessive sweating and red palms of your hands. Rheumatoid arthritis is a long-term condition that causes pain, swelling and stiffness in the joints. The condition usually affects the hands, the feet and the wrists. There is an increased risk if you're a woman or have a family history and smoke, and there is no cure, but treatment can include medicine to relieve symptoms, physiotherapy and occupational therapy, and potentially surgery. Section 3. Acquired immunity. There are 2 types of active immunity and 2 types of passive immunity. The 2 types of active immunity are natural active immunity and artificially induced active immunity. And there are 2 types of passive immunity, which is natural passive immunity and artificially induced passive immunity. Natural active immunity develops from exposure to a specific pathogen, and artificial immunity includes exposure to a pathogen for a specific purpose in the form of vaccinations. During natural passive immunity, antibodies are transferred from one person to another via prenatal or postnatal interactions between a mother and a child, and artificially induced passive immunity occurs by injecting or transfusing antibodies from somebody else. However, the immunity will only last for a few weeks. Vaccination. A vaccine involves injecting a small amount of a pathogen into a person to stimulate white blood cells to produce antibody, which results in immunity. Vaccines can contain live pathogens harmless fragments or toxins from the pathogen or even dead pathogens. When live vaccines are used, they must replicate in order to create an immune response. Inactivated vaccines are produced in a culture media by growing bacteria or viruses, then inactivating it. They cannot replicate and cannot cause disease. During the primary response, the B lymphocytes identify the antigen, then the plasma cells take time to produce the right antibodies, which allows time for the infection to occur and therefore produce symptoms. Due to the body previously encountering the antigen, the white blood cells are able to rapidly respond and fight it because of the body's immunological memory and memory cells. The benefits of vaccination. Measles is a serious respiratory disease which is highly contagious and can be fatal. As you can see from the graph, it shows measles cases and the vaccine coverage from 1950 onwards. Cases peaked up to 800,000 prior to the vaccine being introduced, and once the MMR vaccine was introduced, cases decreased, and then a second vaccine, which is the MMR vaccine, helped decline cases. Since 1989, there has not been more than 4 deaths per year, and since 2000 there's not been more than 2 deaths a year due to the high vaccination rate. There are still cases. In 2019, 87% of children in England were receiving their second dose of MMR. In Wales and Scotland it was around 92%, and in Northern Ireland it is 91%, whereas the target is 95%. The benefits of vaccination include it protects yourself and the community against the disease, it reduces and potentially gets rid of the disease, it can lead to savings in healthcare as there was not as many cases to treat in hospital, and it can extend life expectancy. For example, flu jabs are extremely beneficial for the elderly during winter. Herd immunity. The more people vaccinated, the less likely contagious diseases spread. WebMD explains that herd immunity is when a large part of the population of an area is immune to a specific disease. If enough people are resistant to the cause of the disease, it has nowhere to go. While not every single individual may be immune, the group as a whole has protection. This is because there are few higher risk people overall, so the infection rate drops and the disease peters out. Problems with herd immunity include failing to produce an immune response in some people, the time taken after having the vaccine for it to be effective, and also not everyone in the community wants to be vaccinated due to personal or religious reasons. The immunity threshold refers to calculating what percentage of the population needs to be vaccinated to achieve herd immunity. The table shows herd immunity in several diseases and the thresholds. The NHS provide vaccination programmes for the flu, and more recently we have seen the COVID-19 vaccination programme take place across the world. The UK has set up several vaccination clinics all over the country, which has made the vaccine easily accessible. There are many factors that can affect the vaccine uptake, for example, the media coverage around the vaccine, influential anti-vaxxers, religion or cultural beliefs, and the knowledge and awareness behind the vaccine. This concludes the end of my presentation, so thank you for listening.